breaking news. The vice president has stepped up to the microphone with his fraud statement. Let's listen.
Several months trying to make sure that we take care of the people's money and trying to make sure that the services that exist for the betterment of our fellow citizens, whether they're low-income kids who need access to food resources, whether they're low-income families who need access to medical benefits, that those programs are protected for the people who actually need them, that they don't exist to enrich fraudsters, but they exist for the American people for whom Congress has said they're entitled. And that's exactly what this fraud task force is about. One of the things that I thought going into it, but that I've learned about fraud, is that it always has two fundamental victims. The first victim is the American taxpayer, who is generously paid into these programs in an effort to give their fellow citizens a leg up. But it also has as its victims the people who are meant to benefit from these programs, who are not able to benefit, or maybe are benefiting less because of what a disaster some of the fraud has wrought in these programs. And let me just give you a few concrete examples of what we're worried about, of what we're targeting, and also what we're going to do to solve some of these problems. So first, we're announcing that the federal government is deferring $1.3 billion in Medicaid reimbursements from the state of California. And the simple reason is because the state of California has not taken fraud very seriously, and because of that, we see a lot of the consequences that I just referenced. And again, let me highlight the fact that this really is two separate victims. So there are California taxpayers and American taxpayers who are being defrauded because California isn't taking its program seriously. But also you have people who've been prescribed medications that they don't even need. Sometimes they've had drugs put into their bodies that they don't need because fraudsters have actually encouraged false prescriptions and false administration of medications. So think about this. You're just a person trying to go see a doctor. You assume that your doctor is doing the right thing, but these fraudulent healthcare providers are getting rich by giving people medications they don't even need. It's a defrauding of the American taxpayer, but it's a violation of the trust that should exist between every American and the people who prescribe the medications. That's one thing that we're targeting, and this is why we're taking this action, is because we want California to get serious about this fraud. The second thing I want to talk about, and it requires a little bit of background explanation, is that we are going to very aggressively encourage the states to take Medicare fraud more seriously. So I think a lot of you understand, but for those of you watching at home who don't appreciate this, the Medicaid system that exists in the United States is really 50 separate systems. The federal government pays most of the Medicaid money, but then each of the individual states actually administers the Medicaid program. Now, we have red states and blue states that go after fraud aggressively, but we also unfortunately have some states, mostly blue states unfortunately, that do not take Medicaid fraud very seriously. So you have what's called Medicaid Fraud Control Units, or MFCUs. These Medicaid fraud, these anti-fraud units within the Medicaid program, we generously, meaning the federal government generously gives these fraud control units many, many billions of dollars across the United States of America so that they can take Medicaid fraud seriously. But let me just give you an example to highlight how absurd some of these Medicaid fraud programs are, because they're not actually being used at all. This is a tool. This is a tool that we want the states to use, but unfortunately, a lot of states aren't using these tools at all. Let me highlight this with just a couple of separate statistics. So, the Hawaii Medicaid program has received billions and billions of dollars from the federal taxpayers. And of course, Hawaii taxpayers have paid in a lot of money into this program over the last years as well. Guess how many convictions or indictments has Hawaii had over the last few years in its Medicaid fraud program? The answer is 0. Not a single indictment, not a single conviction, because the administrators of the Hawaii program just don't take it seriously. They don't think that fraud is a big enough problem. They don't care about protecting resources, and they don't care about protecting that Medicaid program. So what does that mean? That means that if you're committing fraud in Medicaid in Hawaii, at least up until now, hopefully now they're going to take it seriously, you have had effectively free reign from the government of Hawaii to commit as much fraud as you want. That is a complete disgrace. In New York, which does a little bit better, but not by much, New York has had 9 indictments over the last year. 9 indictments. That's a $100 billion Medicaid program just in New York, and you've had 9 indictments. Indiana, which has about a third of the population of the state of New York, has had more than 4 times as many indictments over the same period. So does anybody here seriously think that the good people of Indiana are 12 times more likely to commit fraud than the people of New York? No, of course not. That's absurd. What is happening is that the leadership in New York are just not taking the fraud issue seriously. They're not using these anti-fraud control units to actually investigate and indict the fraud. So what are we going to do to fix that? Today, we are sending across 50 Medicaid programs, we are sending letters that will require them to show that they are effectively and aggressively prosecuting Medicaid fraud in their states. And if they do not aggressively prosecute Medicaid fraud, we are going to turn off the money that goes to these anti-fraud units. And I want to say a couple things about this. You may think, obviously, this is a Republican administration. We're all proud Republicans up here. You may think that this is purely a red state or blue state issue. That's actually not true. We see Medicaid fraud issues in Ohio, the state that I used to represent in the United States Senate. We also see Medicaid fraud issues in a state like Maryland, which is obviously a very blue state. But both Ohio and Maryland have worked with us to take this issue seriously. They've worked with the guys behind me. They've worked with our entire team to make sure that they take fraud seriously. Again, this does not have to be a red state or a blue state issue. This is just basic good government. However, states like California, states like Hawaii, states like New York have completely not taken the fraud issue seriously in the Medicaid program. And so for those states that refuse to get serious about fraud, we are going to turn off that anti-fraud money. And if we continue to find problems, we can turn off other resources within their state Medicaid programs as well. Our goal here is not to do that. We don't want to turn off any money. What we want to do is ensure that people are taking fraud seriously. We want to protect Medicaid. We want to protect Medicare. But we can't do that if the states that are administering those programs are allowing those programs to be fleeced by fraudsters. So we encourage, whether it's California or New York or Maryland or Ohio, we encourage people to work with us. We want to help you use technology and other tools to get rid of the fraud, to get to the root of the fraud. We want to help you. But we can only help these state programs if those state programs are willing to help themselves. So these letters are the first step, the first effort to try to force these states to get serious about prosecuting fraud, and that's exactly what we're doing. Let me just talk about one final issue here. We see a lot of fraud in the home health care and in the hospice care system. I think Dr. Oz will probably talk a little bit more about that. But again, you have to appreciate that this fraud issue is fundamentally theft from the taxpayer, but also theft from people who need these programs. Just last month, a California psychotherapist, a woman who had spent 40 years treating patients, helping people deal with problems, found out that her Medicare program had been turned off, that she did not have access to the resources that she had been paying into for her entire life. Why? Because a fraudster had stolen her identity and signed her up for healthcare services that she didn't need, and so she had been turned off of the healthcare services that she did need. This happens way too much in the United States of America, and it happens because until recently, we did not have a government or an administration that actually took the fraud program and took anti-fraud prevention seriously. So let me just close with one final observation here. First of all, why are we doing this now? Why weren't we doing this 2 years ago? And the simple answer is because we didn't have a president and we didn't have an administration who took fraud seriously. So I want to thank the President of the United States, though I know he's busy in China. All of these efforts, all of these things that we're finding are because we have a president who has told us, take the fraud issue seriously, get to the root of it, and turn off the money when we find out that money is going to fraudsters. So that's exactly what we're doing. But I just want to say that for me, and I think for a lot of people who are involved in this effort, this is very personal. Because I'm not just the Vice President of the United States. I come from a family, and I grew up in a family where we sometimes benefited from these programs. The generosity of the American people is one of the most amazing things about our country. I think all of us, of course, just passed tax day. None of us like paying our taxes, but we do it. And why do we do it? Because we know that it goes to give a bite to a low-income family that can't afford food. We know that it goes to pay the military who keep us safe. We know that it goes to some essential services. But that trust in our government, that trust in our institution, it depends on us taking that trust seriously. How long are people going to pay into programs if they know that that money doesn't go to a low-income kid who needs health care, but that money goes into a fraudster getting rich? This doesn't work, and this doesn't make sense unless we take fraud seriously. So I'm proud to be part of an effort in our government. I'm proud to lead the effort in our government to finally take fraud seriously. We want to protect these programs for the kids and the families who need them. We want to ensure that the American taxpayer isn't getting fleeced. And I'd say just a few months into it, gentlemen, we have done a very, very good job. Let's keep it up. So let me turn it over now to Andrew Ferguson, who's the Executive Director of our Anti-Fraud Task Force. Andrew has done an amazing job, but I have to give a special shout out, not just because she's my fellow Ohioan, to Kim, who has probably found more fraud and has saved the American taxpayer more money than any single official within the government over the last 3 months. Kim, you have been an all-star. We're proud to have you on the team. Thank you, guys.
Well, I couldn't have put it better than the Vice President did. The only reason that what happened today happened is because President Donald Trump took this issue seriously that has plagued this country for decades and is committed to an all-of-government approach. And so to him is to who the credit goes. But the Vice President deserves tremendous credit here. It's hard to get the whole machinery of government moving. You need someone with the Vice President's abilities, with his gravitas, and with his determination to drive at these issues. That's the other reason we're here today. And while I'm at it, I want to thank Dr. Oz and Kim Brandt. A lot of the fraud problems are at HHS, and these two have committed countless hours, night and day, their staffs, their resources, to getting at these problems and fixing it, and where the states are unwilling to do their jobs and fix these problems, Dr. Oz and Kim have stepped up to take care of it. He's not up here today, but I want to thank March Bell as well. He's the Inspector General of HHS. A lot of the work we're going to have to do to get the states back in line and stopping fraud is going to go through March's office. You'll see his signature on the letter that went to the state Medicaid control units today. There's going to be a lot of work happening in the IG's office, and we're really pleased to partner with him. It's a shame we have to be up here at all, and with all due respect to the press, with this room full of reporters. It should not have taken a brave kid with a cell phone camera to point the American people at this issue. This is the result of decades of corruption, particularly in blue states like Hawaii, like the Vice President was just explaining, California, Minnesota, and New York, that have taken tens of billions of dollars to pay lawyers to go after Medicaid fraud that just simply have not done it at all. That's the whole point of these programs. If we have these cooperative federalism programs, we love federalism, we want to partner with states, we love subsidiarity, but if the states are going to participate in this, they have to protect their own citizens when they get access to these dollars. And not only are these dollars supposed to go to fight Medicaid fraud, I want to shine a light on the real human dimension of the complete negligence and malfeasance of some of these states here. One of the things they are obliged by law to do is stop elder abuse. That is one of the express commands that Medicaid fraud control units are given, is you are supposed to police Medicaid abuse and elder abuse in the Medicare system too, where so many of America's elderly citizens receive care. And so when the states just take this money and turn it into a jobs program for blue state lawyers, they are effectively participating in the elder abuse in those states, because the American people turned over their money to these state programs to protect their parents and their grandparents from elder abuse. And if you aren't doing it, you are effectively participating in that process. The Vice President highlighted this problem that we have in Medicaid, which is if a fraudster takes your identity, signs you up for benefits, when you go to try to get the actual benefits you need, you can be denied them. This is a problem we have found all over the federal government in benefits programs. I mean, imagine, we have examples of this. A mother on SNAP benefits going to the grocery store and trying to scan her EBT card to get groceries for her children, and some gang somewhere in California took her identity, maxed out her EBT card, and so her children are going to go hungry because of fraud that no one in the states is policing. And that is why what we are doing today is so important. The states should be our partners with this. We want to partner with the states, but what we aren't going to do as stewards of the American taxpayer dollar is to send those dollars, billions of them, to the states to line the pockets of state attorneys general who don't want to participate in protecting our benefits programs so that the people who really need them, The people that the American people have agreed to part with their hard-earned dollars to help, to defend, to protect, and to get through hard times actually get the money. And if the states don't want to cooperate, for the first time, HHS, the Fraud Task Force, the Vice President, and the rest of the federal government are going to tell you, cooperate or lose your funds, and we will do the job for you. Because at the end of the day, if the states won't protect American citizens, the President of the United States and the Vice President will. And that is why I am so honored to be able to participate in this process, because this is ultimately about making sure not only that we aren't stolen from as taxpayers, but the American people who are entitled to this. For Medicaid and for Medicare, people who have paid into these programs their entire lives actually get the benefits that they are entitled to. And with that, I'm going to turn it over to Dr. Oz to talk about all of the efforts at HHS.
Thank you, Andrew. Mr. Vice President, thank you for the leadership, the spirited desire to harness a group of stallions. They're back there, by the way, if you want to see the men and women who are leading the task force. They're at the back of the room, but they've done all the work that allowed us to come up here. In February, we had the largest anti-fraud announcement from CMS the day after the State of the Union address, in which the President created this task force and appointed the Vice President to lead it. Today's effort is larger. It's much larger. And there's a reason for that. Half of the fraud, we believe, in the federal government could be coming out of healthcare services. We're a large rhino that can be stabbed effortlessly by foreign governments, like syndicated criminal entities, and smaller time operators who can take advantage of the system with, as Andrew pointed out, as little as a Medicare beneficiary number, which is basically a credit card, to defraud this system. Unfortunately, that results in about $100 billion of estimated theft just from Medicare and Medicaid. That, just to put it in the context of affordability, which is a very important subtext of this discussion, we would be able to double the life expectancy of the Medicare Trust Fund if we could deal with the fraud issues just in Medicare. So anyone who's out there working their tail off, hoping Medicare will be there with them and for them, and we know many young Americans don't think that's going to be the case. It will be the case. If we take the fraud out, it'll be there for you and your children as well. And stopping this as a means of extending the Medicare Trust Fund is a noble purpose, but as has been pointed out by the Vice President and Mr. Ferguson, is about the human costs. Because if these fraudsters are willing to take your money, they will definitely steal your life and take your health along the way. So let's transition to the 5 major actions. I'm going to go through them in order. I'll share them with Kim, who her nickname is Killer Kim. Mr. Vice President, you'll learn why in a second. She is unstoppable, and you want federal employees like Kim out there like bulldogs going after this fraud. It's right there for us to find. And if we have partnership with the states, it'll help a lot. First,
we need a better nickname for her if she's going to work in healthcare.
She's a Buckeye. She's a Buckeye, so I gave her a choice. Is that a typical name in Ohio?
I don't, not that
Okay. California Medicaid deferral that the Vice President mentioned is $1.34 billion. Their submissions of Medicare records in the backup estimates are generating major red flags for us. And we have looked carefully at these records. We are allowed to audit, looking back for a quarter. Dan Brillman, Caprice Knapp, who lead the Medicaid program, spearheaded this effort with a great team. We've discovered $630 million in billing from the folks who are egregiously the top 5% of outliers in billing. This is numbers so big you can't imagine anyone billing for these numbers of patients and that much for each patient. And so we're asking California to clarify for us how it got there. Second big area of observation is when you bill within a state, you should be comparable to the states around you. But in California, that's not been the case. In California, the growth of spending in personal care services, in-home services, is twice the rate of the average of the rest of the country. Let me say that again. The rest of the country is at one number. California is twice that number in its growth rate. We estimate there's $500 million that could be at risk, taken from federal taxpayers. That means people in New Mexico, which is a blue state, are paying extra taxes so that California can get away with something that they can't defend. So there's $500 million there we're going to defer till they can show us more convincingly why that's the case. And there's another $200 million that we're stopping in questionable expenditures. Much of that is linked to immigration-related costs. You know, folks who are undocumented, and we're not sure why we're paying for this. And as you know from the Working Families Tax Cut legislation, which I'm going to emphasize is a program that saved Medicaid The President and Congress saved Medicaid with that bill. That became legislation. There's another $200 million at risk there. Added together, $1.34 billion. It's the largest deferral we've ever made. We're making it for a good reason. We'd like the state to at least come to the table and explain to us how these outlier payments have been generated. Second major issue is home health care fraud and hospice fraud. So let's just clear this up. Hospice, end of life, designed 40 years ago, a beautiful program that's designed to take care of you because you have cancer and you're not going to survive more than 6 months. To do that, trade your Medicare benefit for hospice benefit. So you give up Medicare, because why would you want to have coverage for things you choose? You're dying. You want to die with dignity and grace. It's a beautiful program. Unfortunately, in California and other states, fraudsters have stolen it and given you hospice you didn't want, which means you're not getting care. And you can't even find out what happened because you weren't in the mix of this. There have been a lot of people complaining about this over the years, including people that should have been listened to, like the Auditor General of California, who in 2022 raised this issue to the current governor, and for some reason they have not taken action. Unfortunately, we have a reality that, again, we got to face. A third of all hospices, a third of all these programs in the entire country are in Los Angeles. Ask yourself, how is that possible? It's not. There are not that many people dying in Los Angeles. We're not talking about California, just Los Angeles. So Kim and the team, with Janina Wugo and a bunch of other great folks, went through the list of all the people, and we believe that at least half of the hospices in the entire area around Los Angeles are fraudulent. And today we announced 800 of those hospices have been suspended. That's getting us, close to where we think we should be. 800 hospices that last year charged the federal taxpayer $1.4 billion will no longer be paid. Now, Mr. Vice President, if your core business was shut down by the federal government, would you call?
Yes.
You would call. Crickets. We have less than 20 who have complained. We're not even sure those are legitimate. 800 hospices shut down, and we're not hearing much. It's crickets out there. So we believe we're on the right path here. Next is a nationwide moratorium on all new hospice and home health care. Why is that possible? Because when we squeeze the balloon in California and slow their growth of hospice and now take away 800, the payments to 800 hospices, we know what those fraudsters do. They move to nearby Nevada. Next door, Nevada has a 7-fold increase in hospice already. Arizona, Texas, they're moving across the country. So we've today announcing a moratorium nationally. There will be no new hospices or home health care open in this country. If you have the program now, you can keep it. You can go to ones that already exist. We're not taking away any services, but there will be no new licenses granted until we can figure out a better way of working across government. Let me highlight this, because when Andrew, who's leading, and the Vice President are chairing this task force, it's very simple. You have CMS, you have OIG, March Bell sitting over there. You have the Department of Justice, you have the FBI, you have Treasury. You put those things together, you make a powerful fist. And that's the fist we're going to punch through bureaucracies and realities that are stopping our ability to protect the American people. I'm going to leave you one last thought, and then I'm going to ask Kim to cover some of the issues around the Mufukos and the Medicaid war room that she's creating. It is a reality that states are all over the place in their desire to partner with the Vice President in this task force. There was a letter sent out 2 weeks ago asking every single state to respond within 10 days to whether or not they will be willing to revalidate their providers. What that means is if you're providing home health care services, which are unlicensed people, providing services in undocumented areas that are unverifiable right now in many instances, basically you're having your kids carry the groceries upstairs for you. These are services your family used to provide for you. We asked all the states to work with us to validate if these are legitimate services from legitimate providers. Every single state responded. So contrary to the narrative around red and blue, every state wants to protect their citizens. Some are just more competent or brave enough to actually make those steps. And for some reasons, as you heard today, California has been lax in this endeavor. We hope this wake-up call will be heard loudly across the beautiful state of California, whose people we're trying to protect, sometimes from their own leaders. Kim?
So when we took office a little over a year ago, we were looking at the fraud and abuse issue and saw that it was all pay and chase. We were going after the money after it was already out the door. And so we thought there surely has to be a better way. So we created the Medicare fraud war room, where we looked at claims in real time before they were paid so that we could determine, were they legitimate? Were there the outliers that we've heard examples of today? And how could we stop it? Over the past year, since the Medicare war room started on March 31st of last year, we have stopped over $2 billion from going out the door just by targeting those high-risk providers. Recently, a couple of weeks ago, we've decided to take it a step further, and we're now doing a Medicaid war room. And what's unique about this is it's the first time that we've ever partnered across the board with our law enforcement partners, the HHS OIG, DOJ, the states, the MFUCAs, the Medicare Fraud Control Units, all working together for the first time to look at Medicaid claims in real time and be able to determine how we can stop those payments from going out the door, to stop the instances of an 89-year-old woman who had over 5,000 skin substitutes, or to stop the types of things that are just really aberrantly ridiculous. So what we've done is we have data analysts, we have forensic auditors, we have law enforcement people, all coming together in a virtual room. It's not an actual room like you think of like on TV, but they're all in a virtual room where they are looking at this in real time and then making determinations about how we can shut those bad guys down and how we can take action. And what has happened is we are now using our administrative authorities, payment suspensions, overpayments, civil monetary penalties, and the HHS OIG exclusion authority to really be able to take action against these people and make it so that we can hopefully bring that money back where it needs to and never let it go out the door. The key is we want to keep it so that it can provide the services for the people who most need it and who most benefit from it, and stop the bad actors from getting all the benefit. Thank you.
Thank you, Kim. So, Dr. Oz, I want to make sure I understand this well. So you're saying that we kicked off 800 fraudulent healthcare providers off of the Medicare system, and not a single one of them called the government and said, hey, you made a mistake?
We've had a handful of calls. We're not sure they're legitimate yet, but it's less than 20 out of 800, and we're auditing them.
Unbelievable. So at least 780 are not even trying to claim that they're not fraudulent. And again, those are businesses that we were giving hundreds of millions, in some cases billions of dollars to, not to provide services, but to make a fraudster rich. It's just completely insane. Drives home the scale and scope of the problem. Okay.